registered physiotherapist. Today I'd like to talk to you about a term called ITB Friction Syndrome. And essentially what this condition refers to is when your IT band, which is essentially some connective tissue that runs right from the hip all the way down to the knee area, when it gets really tight, it can put some pressure on two very specific areas. One is right along the hip joint here in particular, where there's a bursa there essentially, where in a lot of cases it'll create hip bursitis, and also where it sort of crosses the knee joint and where the condyles of your femur and your tibia, essentially where they meet. And what will happen in a lot of cases in both these regions, right? When the IT band is really tight, it will rub on the bone of the knee, it will rub on the side of the femur, it will rub on that bursa, and this rubbing creates inflammation and pain, and this is what's referred to as IT band friction syndrome, essentially. Now, one of the tests that we do in the clinic for this is to essentially have the client balance on one leg, right, and then do what's referred to as a single leg squat. In a lot of cases, when the patient does a single leg squat, it will provoke this rubbing that I was describing and will cause the pain that the individual has been describing. Now, in a lot of cases, this IT band friction syndrome has to do as a result of these different muscle imbalances that can take place within the hip region. So in a lot of cases, what I'll find with these particular people is they will have very weak glutes and really tight in the anterior portion of the hip. So your psoas, hip flexor, quads, all these different muscles that actually attach onto the IT band. So in terms of treatment, in a lot of cases, it will revolve around correcting these different muscle imbalances that occur, rolling out in a lot of cases the IT band, again, to relax that muscle, and then to work on specific functional strengthening exercises. Also, please make sure that this is sort of the correct information for you by speaking with a physiotherapist or a doctor. And thanks again for watching. Have a great day.